Did you know that researchers tested lavender against the prescription benzodiazepine and it worked just as well for anxiety without any of the side effects of benzodiazepines like dependency, withdrawal, memory problems, or risk of falls? So why are psychiatrists and other mental health providers not discussing and prescribing this for their patients? I'm Dr. Eyre, quadruple board certified psychiatrist and anxiety expert. Rachel was 48 when she came to see me. High pressure job, aging parents, constant low grade worry that followed her everywhere, from meetings to her daughter's school drop off to lying awake at 2 a.m. She had tried therapy and multiple SSRIs that left her foggy and unlike herself. When she came to see me, she wasn't just anxious, she was exhausted from trying to manage it. She wasn't willing to try any more medication, so I suggested lavender. Not a candle, not a diffuser, a pharmaceutical grade oral extract called Silexan. I recall she had looked at me at the time as though I was joking. In a few minutes, I'll tell you what she said 5 weeks later. But first, you need to understand why this works. Most people assume lavender calms you the same way XANAX does, just weaker. That assumption is completely wrong. The mechanism is different, and that difference is the entire point. Lavender contains two primary active compounds, linalool and linalyl acetate. Benzodiazepines, XANAX, Valium, lorazepam, work on the GABA pathway, the brain's braking system. But they cause the sedation, mental fog, dependency, and a withdrawal process that can feel worse than the original anxiety. Silexan doesn't touch that pathway. It works through two mechanisms at once. It acts on the serotonin receptor, the same one targeted by medications like SSRIs such as Zoloft, Prozac, and Lexapro. It also acts on calcium channels in brain cells, directly reducing that excessive firing. In a clinical study, Silexan 80 mg daily was compared head-to-head with lorazepam, a prescription benzodiazepine for generalized anxiety disorder. After 6 weeks, this study showed comparable reductions in anxiety, comparable to a prescription benzo, but the Silexan group had no sedation, no brain fog, no sexual dysfunction, no weight gain, no dependency, and at the end of the study, there were no withdrawals. These side effects are some of the reasons you may have stopped your medications. It's the reason anxiety goes undertreated for years. I see people who stop the prescription they genuinely needed because the side effects made their life unlivable in a different way. They traded one problem for another. This is where a medication like Silexan may come in. A second trial compared it to paroxetine, a commonly prescribed SSRI for anxiety. Again, comparable anxiety reduction without the weight changes, sexual side effects, and discontinuation syndrome, which makes so many people afraid to start on SSRI in the first place. The side effects of Silexan were limited to mild stomach upsets. Another large study showed consistent, meaningful reductions in anxiety across different populations, across different anxiety types. Beyond anxiety reduction, Silexan also reduced depression and improved general mental health and quality of life. Now on to the most important part of this video. Not all lavender is the same. The diffuser oil, the dried flowers, the essential oil on your temples, that's aromatherapy, legitimate for short-term stress relief, but not what the clinical anxiety trials are based on. Every study showing results comparable to prescription medication used Silexan, oral, pharmaceutical grade, 80 mg daily, standardized to consistent active compound levels, third-party tested for purity and potency. When patients tell me lavender didn't help, I ask one question. Was it oral Silexan? It never is. Active compound, delivery route, dose, standardization, that combination is what separates clinical evidence from a pleasant smell. If anxiety is also disrupting your sleep, and for most people it absolutely is. Poor sleep keeps the nervous system hyperactive, which worsens anxiety, which destroys sleep further. Breaking that loop matters as much as any supplement. My free sleep guide is in the description, built specifically for anxiety-driven sleep disruption. Download it, use it, share it. Now here's what I tell my patients. For ongoing anxiety, 80 mg of oral Silexan once daily. Give it at least 6 weeks. Full effect often develops at 8 to 10 weeks, so don't give up early. For acute stress and short-term sleep support, aromatherapy has a real place. A few drops near your pillow, a diffuser before bed. It's the difference between putting ice on a sprained ankle and actually rehabbing the injury. Both have value, but one is for acute relief, the other is for long-term treatment. Now the hormonal picture, because many people feel the anxiety suddenly worsened in midlife. For women going through perimenopause and menopause, estrogen normally buffers the stress response and stabilizes mood. When it fluctuates wildly and then drops, that buffer disappears. The nervous system may become more reactive. Anxiety that felt manageable can quickly become overwhelming. For men, testosterone declines about 1% per year from the mid-30s. Slowly enough that most men don't notice until they're in their 40s. In some cases, stress tolerance may diminish. Sleep may worsen. Recovery from stress may take longer. Anxiety could become harder to manage. Silexan can help turn down the nervous system in these situations with only mild stomach upset, occasional burping, a faint lavender aftertaste. These are usually temporary and mild. That's it for most people. No addiction, no withdrawal, no cognitive impairment, no sexual side effects, no weight changes. One caution though, if you're on sedatives, sleep medications, or any CNS antidepressants like benzodiazepines or opioids, tell your doctor before adding Silexan. This is because it can amplify the effects of these medications. Silexan works best when the rest of your system is working too. Think of it like this. Silexan is a powerful tool, but it is not a standalone fix. It is more like a key that works best when the right doors are already open. And those doors are sleep, movement, nutrition, and stress regulation. Here's what I see in my practice. People who add Silexan on top of a foundation of good sleep and consistent movement often notice a real shift. Their nervous system has room to improve even faster. It's like the lavender has a good foundation to maximize its full effect. But when the nervous system is still frayed, when sleep is fragmented, when blood sugar is crashing at 2 in the afternoon, when stress has been compounding for years and is at an all-time high, Silexan may take the edge off, but it is working against a much stronger current. And this is where most people get stuck. They find one tool that helps a little, they lean on it completely, and they wonder why the anxiety keeps coming back. Sleep changes how your nervous system processes threat. Movement helps relieve the stress that keeps your body in a state of high alert. Anti-inflammatory nutrition helps control chronic inflammation, stabilize your blood sugar, and improve gut health. And stress regulation goes a long way in controlling your cortisol rhythm and keeping you mentally and physically stable. Silexan fits beautifully into this picture. It is one of the most well-researched natural supplements we have for anxiety. But it is most powerful when it is a part of a complete approach. Because your nervous system did not get dysregulated from one thing, it will not fully recover from one thing either. Remember Rachel, whom I talked about earlier? 4 months after she started on Silexan and made the necessary lifestyle changes, she felt completely different. She felt herself again, the version of herself she had described losing. She told me lavender gave her back something she thought was gone permanently, the ability to feel calm without feeling numb. I keep coming back to that phrase because I've heard versions of it from more patients than I can count. People who spent years trying treatments that either didn't work or worked by taking something away from them. To find out other natural ways to treat your anxiety, check out the next video.